So, welcome everyone once again for this short session on application of usual, customary, and reasonable charges. So, there were many of the doctors who have been calling me from the sessions who have attended at the National Insurance Academy and multiple locations. So, today I thought that this is the right time to have a short video on how actually this concept is developed and how we have to look at it in the long term and how we can actually implement it without any deviations, without any regulatory apprehensions, and especially for those employees who are afraid that if they apply wrongly or miss to apply, and then there are, say, recoveries, then they would lose up on their incentives. So, multiple issues and same problem, usual, customary, reasonable. So, while we are going to be discussing about it today, let us understand a few basic concepts about this usual, customary, and reasonable aspect. I'm going to try to keep it as simple as possible so that we take this as a lesson for our implementation. The objective is how can this topic be simplified in such a way that it becomes easier for all of us to understand. And at the same time, we ensure that there is profitability for the insurance company as well at the same time. So, coming to the basics, first let us understand what is health insurance. We all know we have been working in this sector. So, it's a contract between the insurance company wherein they're taking on the responsibility of covering the medical expenses and in exchange for, say, a monthly, a quarterly, or an annual premium. And it helps the insured person because they are protected from the high healthcare costs, and they also get access to quality services from the network providers. So this is the reason why health insurance is there. An importance, basically protection against high medical costs, access to quality healthcare, peace of mind during emergencies. Many of the plans nowadays encourage preventive health checkups, and definitely we get the tax benefit. So with this background, let us come to our basic problem statement today. Usual, customary, reasonable. So what I did is I went through all the IRDA policies which are there, and you will see that almost everyone, all the policy documents have the same words. Reasonable and customary charges means the charges for services or supplies, which are the standard charges for the specific provider, and consistent with the prevailing charges for the geographical area for identical or similar services, taking into account the nature of the illness or injury involved. So, this is what we are talking about. So, few aspects here becomes important. First is charges are for services or supplies. They are to be standard, specific provider, consistent, prevailing, geographical area, identical, similar services, nature of illness or injury. So these words become important. And that is why here you will see what we are talking about is a standard provision in Indian health insurance policies. Now, why insurance companies have put it into practice is because they want to determine the maximum payable amount for the medical service. Otherwise, there are huge expenses which come up. So let us break up these three words in detail. Now, what is usual? So usual means, as you can see here in this particular slide, it is a typical fee charged in a specific area for a given service. So usual entails two aspects. It is specific area, given service, and that is a typical fee. So that is usual. Then what is customary? So customary means the fee falls within the common range for that service among similar providers. So it is common range is mentioned now in customary. So usual will be what is typical fee, and customary is within a range, because not necessarily it is the same provider, right? So it could be a range for that service. So what is an example? Suppose I am talking about consultation. So for consultation, the common range for a say general physician would range from 100 to 500 rupees. So that is customary charge. Usual is say 500 rupees in the specific area. And then we come to reasonable, usual, customary, and reasonable. So the reasonable means that the fee is based and considered justified because it is based on complexity, resources required, and prevailing market rates. So three factors which are interchangeable here: complexity, resources required, and prevailing market rates. So when we say complexity, it is directly correlated to what is the patient condition. When we say resources required, it means what is the expertise of the service provider. And prevailing market rates, again, it's an interplay between usual and customary. So the insurers use UCR to cap reimbursements, paying only up to the standard rate for a procedure in that region, regardless of the bill, the actual hospital bill. So the question comes, if the actual hospital bill is high and we are applying UCR and there is a deduction, is it the fault of the patient? Why should the patient suffer? The response is the patient is not suffering. A tea is available, as we all know, on the roadside. A tea is also available in a standard hotel, and the tea is also available in star hotels. The cost differs. Now, it is up to the patient where he wants to take it. And even within the star hotels, the charges for the tea vary from one to the other. And it all becomes, even within a same star hotel, the charges would vary based on the tie-up tariffs which are available and your ability to negotiate. And when this insurance contract was signed, it was clearly mentioned that all the expenses are going to be payable as reasonable customary only. So the insured is already aware, and if still he is going for a higher charge, it is his own desire. So then the question comes, why actually do these charges or the UCR clause gets applied? And the answer is, but obvious. It is done to control the healthcare costs and prevent overcharging by hospitals. Secondly, to standardize claim settlements across different hospitals and regions. And thirdly, to discourage inflated billing and potential fraud. So when to apply? It is definitely in the reimbursement claims, especially when the hospital is not part of our network, or whenever we feel that the applied charges are high as compared to the area norms. For example, even in network hospitals, some hospitals ask for charges which are not part of the printed schedule, and they seem to be very high. So at that time, we apply the UCR talk, and that is where the case management role comes into picture. That is where the repricing role of the provider networking team comes in. So though the clause is not typically used for cashless claims, still at times it can be required to be applied. So how is the clause applied? So for that, first and foremost, we do the assessment of charges. So when a claim is filed, the insurer or the TPA, which is appointed by the insurer, they compare the billed amount with the UCR rate for that procedure in same city and hospital type. This same city and hospital type is very important because practically when I'm going to be demonstrating, now this practical demonstration will vary with organization to organization because each organization would have different capabilities of understanding the benchmarking data. But something which remains common is that it has to be done by same city and hospital type. So once that is done, if the hospital has charged more, then we approve only up to the UCR amount and the policyholder pays for the remaining amount. So if charge is say 50,000, but UCR is 35,000, then we will pay 35,000, 15,000 deducted, and then the communication has to be proper. Now this is very important step. The claim settlement letter will mention the deduction under terms like reasonable and customary charge or UCR limits. So step by step process. So we review the claim, we review the detailed hospital bill, we analyze the nature of the procedure or treatment, we understand the clinical condition of the patient, how much the patient has been having an issue. So we arrive at a patient scene in our mind, considering whatever is the clinical status. And we come to know, okay, this is a general within range, or there is something emergency or something extraordinary for which something more will be required. And once we rule out that extraordinary part, once we know it is not an outlier, then we see if the claim is from non-network hospital and the charges are unusually high. So then, if you know that the charges are high, you have to refer to the internal database, IRDI guidelines, or some third-party data is also available nowadays to determine the average cost for same procedure, same city, and same hospital type. So suppose the treatment is taken in say Vishwaraj Hospital, you cannot apply the charges of say Kamal Nayan Bajaj Hospital of Sambhajinagar for that. So here what is needed to be considered is the hospital standard rate card, prevailing charges in the geographic area, complexity and nature of the medical issue. And then we calculate. If the billed amount exceeds UCR, then we approve only up to UCR and we deduct the excess amount. And I already shared the example with you previously. And then we have to communicate and document. We also need to provide a brief rationale. And at times it may be very, very important that we have to share the UCR data used for benchmarking. So whether it is Dr. A or Dr. D or Dr. Z in the insurance company, everyone has to apply it in the same way and objectively. Then only it is appropriate, otherwise problems. So can there be exceptions? And if yes, how do we handle it? Yes, definitely. We need to also know how do we handle the exceptions. Like if the treating doctor is able to provide evidence of medical necessity for higher charges, complications, comorbidities, then we should consider approving above UCR payments after review and documenting that this is the reason. We should always document reasons for exceptions and approvals. That is key important activity to be done by us. So best practices, stay updated with the current UCR rates, ensure transparency in deductions, be ready to justify with data, encourage hospitals to provide detailed billing justification for higher than average charges. So these are the steps. We review the claim by scrutinizing bill, identifying if UCR is to be applied, benchmark, compare with UCR rates, internal, external data, deduct the excess, communicate appropriately, and handle the exceptions. So before I say thank you, let me all summarize that applying UCR clause ensures fair, standardized claim settlements, prevents inflated payouts, Consistent application, transparent communications are key to maintaining trust, regulatory compliance in health insurance claims. So, before you ask a question, practically demonstrate to कीजिए sir. So the answer is this practical demonstration will vary from each organization to organizations. Like I know of certain organizations who have developed a BI tool to get this data. Some organizations who have developed Python-based portal to get the data. But practical step is first and foremost, what we need to do is practically, if we were to do it, like I'm going to be opening a whiteboard here. So the first step which has to be done is very first activity is pin code. So please forgive me my handwriting. So I am again doing, I am a doctor. So pin code is important. To apply any PUCR charge, you search your old databases based on whatever portals you have on the pin code. And then in the pin code, you look for ICD code. Okay, what is the ICD code of my current ailment? So I search historically what is the other elements on the same ICD code, and then I go for the treatment. So it's always got to be a PIT, PIT. So first is treatment. So first is pin code, then it is got to be ICD code, and then treatment. So this is how you will be searching for it. And once you are confident about it, then you need not worry. Now it may happen that in a particular location or a pin code that you are looking for, there may not be sufficient hospitals. So we know pin code is 6-digit, example 400001. Now, definitely there are many hospitals here. Suppose my pin code was 400109. And then I have searched the ICD, I have searched the treatment. And I find that historically, whatever database, whatever tool I'm using, I'm not having it. So what I do is I change the pin code or I select multiple pin codes 40010X. So 9 के आजू बाजू का 8, 10, and then maybe I'll add up 7, 6, 5, 4, 11. So all the hospitals in the geography get covered. Still I don't get, I add up the near similar treatment or remove the ICD and select only on the treatment part. And that is how I will be coming to the conclusion. So this is what has to be done by all of us. And when we start doing it, then only we are going to be successful. So thank you very much. If there are any doubts, any questions, you can always WhatsApp me or you can contact me through my YouTube channel. Thank you. Hare Krishna.